Next, I'd like to ask Dr. Ali Asgar about Acarbose, a drug which acts on the intestine and it prevents the absorption of glucose. Do you think that when you explain the mode of action to the patient, and in our subcontinent, we are very much dependent on the high carbohydrate diet, do you think the patients are reluctant in maintaining the dietary adjustment, thinking that Acarbose is preventing the absorption of glucose so I can eat as much as I wish?
I mean, fantastic, Dr. Sana. This is the question patients always ask when we prescribe Acarbose. Now we know it blocks it blocks the absorption of carbohydrates basically. So patients definitely do think that now they can eat as many carbs as they possibly can. Now we need to go back and look as to how medications work. So if we see SGLT2 inhibitors, they're not going to block the reabsorption of all the glucose that's coming up through SGLT2 receptors. So SGLT2 inhibitors will give an A1C reduction of 0.6 to 0.8 to at best 1%. Same goes with Acarbose. It's not going to block all the glucose that or all the carbohydrates that we are eating. So it's going to give a modest reduction of 0.8 to 1%. And this is what patients need to understand, that if you are taking Acarbose, you cannot simply eat as many carbs as you can, because the more carbs they take, more flatulence, bloating, and more GI symptoms. And this is the biggest problem giving Acarbose basically. And again, if we see the algorithm of diabetes management, metformin, SGLT2 inhibitors, the DPP4 inhibitors, the GLP-1 analogs are much ahead than Acarbose in the current algorithm of diabetes management, whether those are international guidelines or guidelines in the subcontinent. So again, if somebody is taking Acarbose, they have to realize that they have to again do a proper diet. And I think this is what people and our patients need to understand, that it's not a medication that will work for them alone. We all know that diabetes has 3 pillars of management, and medications is just one part of that. Diet is extremely important, even though if you are on a medication like Acarbose, which will block carbohydrate absorption. Exercise is the 3rd pillar in diabetes management. And I think when we talk about all these medications, and I've seen other topics have been brilliant, people need to understand that there has to be all these 3 pillars intact for a better management of diabetes control.
Thank you.